Hi everyone, this is Debbie Cohen with Fundamental Physical Therapy and Pelvic Wellness. This is the first in the series of questions about prostatitis. One of the most common questions that I'm asked, beginning with the whole subject, is of course, what is prostatitis? Well, it's basically a collection of symptoms that you have to know about, and the word prostatitis just means an inflammation of the prostate gland itself. The collection of symptoms are really what concerns people, and it may or may not be caused actually by an inflammation of the prostate gland. So how do you recognize if you have what's called prostatitis, or often diagnosed with that name? It might come in the form of urinary symptoms like urinary urgency, frequency, pain in the bladder, difficulty urinating, or pain with urination. It might be sexual dysfunction, where there's erectile dysfunction, early ejaculation, or pain with ejaculation. There might also just be pain in the pelvis related to everyday activities like sitting, walking, exercising, maybe lying down in bed even. And there might be bowel symptoms. There might be difficulty with bowel movements or painful bowel movements. Sometimes bowel movements might alleviate the symptoms, sometimes might make it worse. So as you see, the symptoms of prostatitis are varied, can change a lot from person to person, and what's in common with it most of the time is a musculoskeletal feature where the muscles in the pelvis, called the pelvic floor, are often tight, painful, overactive, tense, have a difficult time relaxing, and carry tenderness themselves when they're touched or stretched. So this is the aspect that physical therapy can help with. And as a pelvic physical therapist, I treat men with symptoms of prostatitis very successfully all the time. And I find out that these men have been to their urologist first, which is a very good first step to take. They may have been prescribed antibiotics to treat a presumed bacterial infection, and it may have helped. It may have helped for a while, maybe not completely, but if they've come to see me, it's because the symptoms really weren't completely resolved, and the problem has persisted for quite some time very often. And we find that by treating and addressing the musculoskeletal problem in the muscles and nerves and connective tissues inside the pelvis, that we can make a lot of progress and often alleviate the symptoms completely. We also have to address the lifestyle choices, things that are going on in a person's life, the way that they're doing things from day to day, exercising, and even postures and sitting and physical activities that are going on. We can really alleviate the symptoms. So if you have any questions about prostatitis or its symptoms, feel free to contact me at pelvicwellnesspt.com or your local pelvic physical therapist, and don't just live with it. It can be treated, and you deserve to have a great life without these symptoms and troubles in your life. So thanks a lot for listening, and I'll talk with you again soon.